back to medical matters now, and the Johnson & Johnson Sisonke vaccination program will resume this Wednesday. This follows a brief suspension due to blood clot concerns. However, pregnant women and breastfeeding women will be excluded, we are told. To discuss this, I'm joined by Dr. Angelique Coeztee from the South African Medical Association. And Doc, we will get to the considerations around breastfeeding, lactating, and pregnant women in just a moment. But let me ask you, how important is it that the vaccination campaign itself, the Sisonke implementation study, will resume on Wednesday?
Good morning, and a good morning to all your viewers out there. It is of utmost importance because we know and we have seen that the healthcare workers was top of the list of people dying or getting diseases during these first and second pandemic, especially during the second pandemic. We lost quite a lot of healthcare workers. Not, as I've said, not even mentioning those that got severe disease and was lucky enough to survive their ordeal in the hospitals. The problem is we are running with a shortage, acute shortage of healthcare workers. So people think that after 10 days you can go back to work. That's not entirely true. After 10 days, you're only disease-free, meaning you cannot give anyone else in close contact the COVID-19. You can't transmit it. But people are not healthy after 10 days. There's a lot of symptoms. We call it long COVID. And those symptoms, if you look at that, most people that we have seen so far, takes about 6 weeks to recover. So if you take all of that into consideration, we cannot afford to have most healthcare workers being on long sick leave because of the complications. Yeah. So this is so needed.
So, I mean, the resumption of the Sisonke study comes smack bang in the middle of Africa Vaccines Vaccination Week, which is running from the 24th to the 30th of April. But there are some words of precaution and caution, rather, around pregnant, lactating women. What's that? What's that about? What's the caution there?
So we're now only talking about the COVID-19 vaccines, and currently there's not enough data. We were told before that you can start vaccinate pregnant women after a certain after they've been a certain term. As we have seen, a lot of the females die in child labor or just afterwards. Some of these pregnant women who contracted COVID at the end of their pregnancy died. But for now, with the J&J, we have cautioned against it and said, listen, let's first get the studies in. Let's first take those pregnant women and do not vaccinate them, but look at what is happening with the data around other countries, as well as what we are going to see in our country. Remember, we are now moving into real-life data. There's only 300,000 plus healthcare workers being vaccinated. So if you look at the United States with Johnson & Johnson, between 7 and 8 million, and by the way, they also continued now with their Johnson & Johnson outroll. So if we then look at it, they will have much more data than we have. So we are looking at real-world data. Now, normally, this would have been part of phase 3B of any study to have data collected for at least between 3 to 5 years. We don't have that luxury. We will unfortunately have to do it the hard way. We are also concerned in South Africa, and it's not only around the Johnson & Johnson, but the efficacy and safety of these vaccines in our people living with HIV and AIDS. There's not a lot of data around them as well. So again, going forward, real-world data would actually be our guidance in this.
So just as a quick parting shot then, Doc, what's your advice? women who are pregnant and planning to be pregnant in the coming months, should they or should they not go for this vaccination?
You should go for the vaccination while you're not pregnant. If you are planning to get pregnant, go and take it now, so that at least it takes 28 days. And remember, the side effects that we normally have seen now, especially in the United States, is within the first 3 to 5 days, very seldom after 14 days. So the quicker you get vaccinated, if you're still planning to have a family, the better. Even if you don't plan to have a family, get your vaccine, because you never know when your pill is not working.
Yeah, no, I realized as I asked that question just how ridiculous it is, because if your plan is to be pregnant in the coming months, then getting it as soon as possible actually is the smart thing to do. Thank you for your insights as always, Dr. Angelique Coeztee there from the South African Medical Association. This is All Angles.